Assalamu alaikum. Now I would like to discuss about Cephalhematoma, mainly neonatal scalp swelling. In neonatal scalp swelling, there is caput succedaneum, there is Cephalhematoma, there is subgaleal hemorrhage. Caput succedaneum, remember, caput succedaneum is subcutaneous. Succedaneum subcutaneous, and Cephalhematoma is periosteum, subperiosteal, between the skull and the periosteum. This is the periosteum, this is the skull. So subperiosteal bleed that does not cross the suture line. So Cephalhematoma does not cross the suture line and there is subperiosteal bleed. There is subperiosteal bleed. But caput succedaneum is subcutaneous bleed above the periosteum. So caput succedaneum, it is subcutaneous, present at birth. There is soft, boggy. It crosses the suture. Caput succedaneum, it crosses sutures. So succedaneum is subcutaneous and suture line crosser. It crosses the suture line. And another is skin is, that means overlying skin is normal. The overlying, look at the succedaneum, the overlying skin is normal and it self resolves within days, self resolves in days. Very, very, very high yield. And caput succedaneum, it, prognosis is good, it self resolves in days. So succedaneum subcutaneous edema or hematoma above the periosteum, edema and hematoma above the periosteum. It is present at birth, edema and hematoma above the periosteum, and suture line crosser, it crosses suture and itself resolves in days. Cephalhematoma. This is cephalhematoma. This is subperiosteal, between the skull and the periosteum, between the skull and the periosteum. It present hours after birth. It is firm and non-fluctuant. It is firm and non-fluctuant. It does not cross the suture line. It does not cross the suture line. It does not cross the suture line and overlying skin is normal. So cephalhematoma does not cross the suture line. It does not cross the suture line. It is non-fluctuant, not cross the suture line, not fluctuant, and overlying skin is normal. And in cephalhematoma, what happens? Hemoglobin, as the hemoglobin for the RBC within the cephalhematoma are metabolized and unconjugated, bilirubin is reabsorbed and can lead to severe hyperbilirubinemia. It resolves within a month. So in cephalhematoma, it results from birth trauma and typically self-resolves within weeks to months. However, as the hemoglobin from the RBC, as the hemoglobin from RBC within the cephalhematoma are metabolized, unconjugated bilirubin is reabsorbed. Unconjugated bilirubin is resorbed and can lead to severe hyperbilirubinemia. And this is subgaleal hemorrhage between the periosteum and the gallia aponeurotica. Subgaleal hemorrhage is between periosteum and gallia aponeurotica. It can expand over days. It is soft and fluctuant. So caput succedaneum, soft and boggy, and Cephalhematoma, not non-fluctuant, not cross the suture line, non-fluctuant, not cross the suture line, and subgaleal. It can expand over days. It is soft and fluctuant, and diffuse cross the suture overlying bruising and can cause life-threatening blood loss. So succedaneum, it is simple like self-resolves hematoma. It can cause hyperbilirubinemia and subgaleal hemorrhage. It is cause life-threatening blood loss. It can cause life-threatening blood loss. So what is the diagnosis? Fluctuant scalp swelling that move across the suture line and can expand for days after delivery and expand if expand days after delivery associated with tachycardia and pallor with excessive blood loss. It is subgaleal hemorrhage. Infants who do not receive the routine intramuscular potassium injection at birth are at risk of bleeding between weeks 1 and 4. Life early onset less than 24-hour bleeding due to vitamin K deficiency and can occur with use of certain prenatal medications, anticonvulsant that limit potassium action. So that is all about neonatal scalp swelling. That is mainly uh, the difference between uh, Cephalhematoma and caput succedaneum. Okay, hope you enjoyed.